Rescigno, and I'm Senior Clinical Lecturer for Newcastle University. And I'm extremely pleased to present today the results of a international collaboration with many colleagues from Italy, in between Italy and UK, about validation of a new score called Meet-URO score that we used for metastatic renal cell carcinoma patients receiving first-line immunocombination. Since I was a trainee, so we are talking about a few years ago now, we have been using a score, also known as IMDC score, that incorporates many clinical and lab-based variables to define the prognosis of renal cancer patient. This score includes, as I was saying, clinical characteristics like performance status according to Karnofsky, other characteristics like the time of metastatic disease from diagnosis, so if it's inferior or longer than a year, and lab criteria like low level of hemoglobin, high level of calcium, high neutrophils, and high platelets to define who are the patients that are with longer or shorter survival. But the most important thing is that this prognostic score was established during the TKI era. Now we have many other strategy and treatment for advanced renal carcinoma, mainly including combination of other immunotherapies or immunocheckpoint inhibitors like ipilimumab and nivolumab, or combination of immunocheckpoint inhibitor plus TKI like pembrolizumab, axitinib, pembrolizumab, lenvatinib, nivolumab, cabozantinib, and avelumab, axitinib. So many of our Italian colleagues have designed and established a new prognostic score, the Meet-URO score, and they have tested this on many case series in first-line or second-line setting. And this new prognostic score includes, within the IMDC score, also the neutrophil-to-lymphocyte ratio that we know being this a biomarker of inflammation in cancer patient with a threshold of 3.2, and also another clinical variable like the presence or the absence of bone metastasis. So we have now validated this score on in a retrospective study including 1,418 patients from 31 different cancer centers in UK. 54% of our patients received combination of immunocheckpoint inhibitor or immunotherapies like ipilimumab and nivolumab, 46% combination of immunotherapy plus TKI, mainly avelumab and axitinib. That is a combination that is available in UK, 24%. And in terms of the new characteristics that we have investigated within the Meet-URO score, 52.5% of patients had high NLR score, so higher than 3.2, and 32% had bone metastasis. So after follow-up period of around 16.5%, we have done some analysis on the overall survival of our patient. And first of all, we were able to stratify using the Meet-URO score patient in 5 different groups, while standard the IMDC score has 3 groups: the favorable, intermediate, and the poor risk. So as you can see, the 3 years overall survival between the 2 different scores is pretty much similar within the first group, so the favorable patients. But the main advantage of using the Meet-URO score compared to the IMDC score is that the Meet-URO score seems to distinguish better the intermediate category, splitting it in group 2 and group 3 of the Meet-URO score. And as you can see, we have the group 2 that has a 3 years overall survival that is much more similar to group 1, so to the favorable group. So we can call it as a favorable intermediate group, while the group 3 has a 3 years overall survival that is much more similar to the IMDC score. And the same, it's true for the poor risk group that is split in group 4 and 5 within the Meet-URO, using the Meet-URO score. So overall, the C index of the Meet-URO score for overall survival is superior than the C index for the IMDC score. And although this model was developed for establish a difference in terms of overall survival, we have also investigated the performance of the score in terms of other two important, other two important factors like the PFS, so the progression-free survival, and the overall response rate. And again, the C index for the Meet-URO score is superior to the IMDC score in terms of predicting the PFS and the overall response rate in the objective response rate, in patient with advanced renal carcinoma. As such, so we can clearly say that in this study that has validated in a different cohort of patients, so it's a validation course from UK, we can say that the Meet-URO score demonstrated the robust and better performance compared to the IMDC score in this large scale UK metastatic renal cell carcinoma cohort receiving first-line immunocombination as immunocombination of two immunotherapy or immunotherapy plus TKI. So our hope is that we can use the Meet-URO score in clinical practice to stratify better our patients and eventually for a more individualized and patient-centered management. And I would invite you to use, so there is the Meet-URO score is available online. And you can search for it online and using in your clinical practice, as many of our Italian colleagues are already doing. Thank you for your attention.